morning. My name is Elizabeth Stewart, and I am filming Discharge teaching for Nursing 215, spring semester 2025. Hi, good morning. My name is Elizabeth. I'm your nurse this morning. I am going to be doing some discharge teaching with you. Could you tell me your name and your date of birth? Yes, okay, that matches my records. I have an order here to go over your medications with you, your home medications as well as your new medications, the side effects, what the results that you may experience of having taken these medications, and when you should call your provider. Okay? Okay. So this is your copy. I'm just going to read this to you, and then we'll go over it, and then you will take it home. We have a copy in the record, and what I suggest is that you bring this copy with you to your appointments with your provider. One of your first home medications is Synthroid, and that is it's a medication for hypothyroidism. You're to take 100 micrograms daily in the morning before you eat your breakfast. Some of the side effects of this medication are weight gain or weight loss, headache, diarrhea, hair loss. The expected outcome for this medication is that you have increased energy, you have an improved mood, your weight stabilizes, or you may even lose a bit of weight, your sleep improves, and you just overall feel more like yourself. It's important that you call your provider if you have any symptoms of a fast or irregular heartbeat, diarrhea, irritability or jitteriness, impulsivity, anything that is sort of out of the norm. If you just feel like amped up and you're not able to kind of feel like you're in control of yourself. Do you have any questions about that? Okay. You've been taking this medication for a while already, so you know how to manage that and what the affected outcomes are. The other home medication that you're taking is Protonix, 40 milligrams daily. Some of the side effects of this medication are blurred vision, headache, diarrhea, nausea, abdominal pain. Excuse me, I've got to just fix my... Okay. Vomiting, gas, intestinal flatulence, dizziness, or joint pain. The whole reason that you take this medication is to protect your stomach from increased acid production. So the expected outcome is that you don't have any discomfort in your abdomen. You don't have like a feeling of needing to burp. You don't have like a heartburn. But you just generally digest your food, and everything kind of goes the way it's supposed to go. Do you have any questions about that medication? Okay. So the new medications that you're on. So when you came here, Mr. Jones, your blood pressure was quite high, and your blood sugar was quite high. So we gave you some new medications, 2 blood pressure medications and 1 medication to manage your blood glucose. The first medication is Lopressor. It's also called metoprolol. It's in the category of blood pressure medicines. It's called a beta blocker. And there are 3 kinds of blood pressure medicines. Your provider thought this was the appropriate one for you to have. Now, some of the side effects of this medication include fatigue, weakness, You can have some anxiety, some dizziness, some nausea. You can also have low blood pressure and a low heart rate. So some expected outcomes for this medication is that your blood pressure and your heart rate are within the normal limits. And the normal limits here are listed in your discharge summary here. So that's like a parameter so that your blood pressure doesn't want to go out of this range. Okay, blood pressure is within a range. And one of the things that we want to caution about is that you always change your position slowly, so that when you're sitting, getting out of bed in the morning, you sit up, sit for a few minutes before you go to a standing position. When you're lying and then you go to a sitting position, just sit. Make sure you've got your, everything in your head is feeling good and feeling like you're not having any vertigo or dizziness. And it's also important to do not stop taking this medication abruptly. And the expected outcomes, as I said, is that your blood pressure will be within the normal range. It's important that you take your blood pressure, so you should have a cuff at home. Take your blood pressure in the morning, about the same time every day, and take it before you take your medications. If your if your blood pressure is not within these normal limits, if it's on the low end of this parameter that the provider set for you, don't take this medication, because it'll make your blood pressure drop even more, and then you're going to experience some real discomfort, like some real dizziness or some vertigo. Okay? So that is metoprolol or a Lopressor, and you're to take 50 milligrams daily by mouth. The next medication that you're been prescribed is called Zestrol. It's also called lisinopril, and you are to take 10 milligrams by mouth daily. It is in another category of medications called an ACE inhibitor. And some of the side effects of this medication are a dry cough, some dizziness, a headache, and some insomnia. If you have any kind of swelling around your face, call your provider immediately, because that's a pretty serious side effect, and we don't want that to happen. Some of the expected outcomes for this medication is also if it stays within the normal range. So those are 2 blood pressure medicines that you're going to be taking. Again, get a blood pressure cuff, look at the parameters, take your blood pressure in the morning. So if you have any concerns, call your provider, but especially if you're having dizziness and vertigo that is continuing. And then the last medication that you're taking is called metformin. You take this daily, 500 milligrams. It's for glucose control. Some of the side effects of this medication are abdominal bloating, diarrhea, nausea, vomiting, and unpleasant metallic taste. So the desired expected outcome of this is that your blood sugar stays within that normal range. The normal range is listed here on your discharge summary. It's a blood sugar that is between two numbers, like a 70 to 120, okay? If your blood sugar goes low, you can experience some unpleasant symptoms like jitteriness, irritability, sort of like vertigo and dizziness. It's important that you check your blood sugar daily just to make sure that you're in that parameter. If you do experience those symptoms, have some kind of instant releasing carbohydrate, like some orange juice, a 5 milligram little piece of candy, a little hard candy, and eat a meal. Eat a meal. Don't go without eating your meals. So that is really all that I have to tell you. Don't stop your medications abruptly. Get a blood pressure cuff. Get a finger stick. An insulin kit so you can check your finger stick, and then also call your provider if you have any symptoms that are unusual or concerning. Thank you.